Kirk, we're back.
Hey, Trevor, how's it
This
going?
I'm doing really well, but this time instead of being on a podcast episode, Kirk, we are at the Case RN conference.
Yes, welcome to Reefer MEDness, the podcast. We're found at reefermed.ca. My name is Kirk Nyquist. I am a self-employed registered nurse working as the secretary with the Canadian Association of Self-Employed Regulated Nurses. And this is my collaborative business practice with a pharmacist.
I'm the pharmacist. My name's Trevor Schufelt. I'm a pharmacist at the Dauphin Clinic Pharmacy in Dauphin, Manitoba, Canada.
Yeah, you quite literally tapped on my dining room window, walked in, we sat down and we talked about how we would enter the cannabis space as a nurse and as a pharmacist in the middle of the bloody continent. And we figured a podcast would do it. So in the 7 years that we've had our business, we've interviewed researchers, we've interviewed scientists, we've interviewed big pharma, doctors, rock stars. And what we're basically focusing on, the thesis that I have is that I'm trying to observe and chronicleize how society is changing its perception of cannabis. We started with the three pillars: Reefer Madness, Reefer Mellow, Reefer Medicine, which gave us Reefer MEDness, and of course. Those three pillars give us an opportunity to talk about the recreation market, the stigma of cannabis, and also how cannabis is medicine. Now, this is the nurse speaking. So I ponder the question, what if we were to replace alcohol consumption with cannabis consumption? What would society look like?
Over the course of this project of Reefer Madness, it really has become very obvious that although cannabis is not side effect free, it's just like all the other medications I dispense in the pharmacy, there are side effects. But when you compare the side effects of cannabis use to the side effects of alcohol use, there's no comparison. Cannabis far, far safer, far fewer chronic issues, far fewer everything than alcohol. So when you compare the two on a safety profile, cannabis wins hands down.
Well, I will tell you from a public health standpoint, I think we would have a better society. Now, that's not just some weeded out, hippie wannabe guy talking. This is from the research. Um, Alcohol costs the Canadian society billions of dollars a year in the sense of the amount of money that the government makes on taxes compared to the amount of money the government spends treating alcoholism and alcohol related issues to society. Cannabis actually brings money into the coffers. So, as a nurse, I can safely say that I have come to understand from a risk management perspective, cannabis is cannabis is not something to be concerned about in comparison to other misuse substances.
No, and that's true. Now, even though, we are not going to snap our fingers and get rid of high fructose corn syrup and alcohol tomorrow, and frankly, these might be utopian dreams that are never going to happen. I think the thing we've touched on many times in the is there's a lot of stigma and by definition, bad stigma about cannabis use, whether people are using it recreationally or medicinally. Um, Cannabis is relatively safe. Nothing is 100% safe. You can get water intoxication if you drink 20 liters of water in a day, but cannabis is relatively safe. And as such, we should, as a society, deal with the good effects of cannabis and not stigmatize those who wish to use cannabis recreationally or to attempt to self-treat or under the direction of a healthcare professional treat some of their ailments.
As health professionals, we have masters. Our licensing bodies um, give us a lot of latitude, but also puts us in a box in how we can speak to healthcare.
But I can talk about cannabis in the pharmacy, which is good, and people come in and ask me about it all the time. But at the moment, what I absolutely can't do is I can't sell it. We've got this weird thing in the how the Canadian system is set up is, I can talk to somebody about their cannabis and what it might be good for and what it might help treat. And then really, I can either help a doctor fill out a form to get it mailed directly to them, or the patient has to go to a rec store. And at the rec store, for obvious reasons, the bud tender, the person who sells them the cannabis, can't talk to them about their medical condition. So I have a pharmacy full of a whole bunch of over-the-counter products that I can recommend that people take for various conditions. But if I want to recommend that they take cannabis, I have to send them either back to their doctor and have the actual product avoid the pharmacy altogether, or I have to recommend they go to a rec store, which again seems wrong. And Kirk, what do you think about when doctors just say, I don't want to talk to you. Why don't you go directly to a rec store and buy whatever you want?
I think that's bad medicine, Trevor. I think that's bad medicine. Um, We are Reefer MEDness, the podcast. We are a podcast for lay people. We are a podcast for health professionals. Our market is to give people a better understanding of cannabis and how it fits into today's society. Please check us out. Go to reefermed.ca and check out our podcast.
Absolutely. We'd love to see you there and watch us, listen to us, spread us around. And, if you got any recommendations for who we should talk to next, we want to hear that too.
Cheers.